Made possible through support from CCDC, Colorado Cross Disability Coalition, Developmental Pathways, and the Arc of Aurora. A THINK+change training.
Hi, I am Hani Rayleigh with the Arc of Aurora and THINK+change, offering you today a THINK+change training on the use or considerations of use of medical cannabis in the community as a person with a disability. Because it's a contemporary subject and there's lots of opinions on it, I want to offer a quick disclaimer that this material has been prepared for informational purposes only and is not intended to provide, promote, or prescribe medical or legal advice. You should, of course, consult medical or legal advisors for specific and personalized advice. So I'm coming to you from Colorado, and in Colorado we are able to utilize medical cannabis as a treatment modality. In order to do so, though, you have to have a qualifying disability to have access to medical cannabis. That includes things like seizures, autism, chronic pain, among others. So if you have any questions regarding whether your specific ailment or disability meets criteria for medical cannabis, take a quick Google search and there will be a list that will help support or better identify whether it makes sense to even review your condition for medical cannabis use. What you need in Colorado in order to utilize cannabis medically is a physician, or maybe two if you're a child, to approve and recommend use in order for you to then process it through the state of Colorado to receive what has in the past been called a red card, less used now, but a medical cannabis or medical marijuana card that allows you access to medical cannabis dispensaries, which provide a different level, likely quality, as well as ratio of the product. It also often drastically reduces the cost of that product as well if you're a medical marijuana or medical cannabis user versus recreational use, which is also allowable in Colorado. So I want to kind of dive in on some terms that are often interchanged but maybe shouldn't be. So hemp, cannabis, and marijuana and CBD all refer to really the same plant species. And it's cannabis, and it grows wild all over the world, and in all sorts of climates it can be grown. And while medical marijuana is often used in society, medical cannabis is actually considered the correct term. So you might hear me or anyone else use them interchangeably, but it's important to know that they're the same thing, just one might be supported in one environment versus another. CBD and THC are two that you often hear about, but they interact really differently with the body. CBD is a non-psychoactive product, whereas THC is considered a psychoactive product and is the piece of the, high, right? Whereas CBD does not offer any of that and is often used for relaxation, inflammation, maybe digestive issues, joint pain, that sort of thing. Whereas THC you often see used for more a medicinal quality, for nausea, for folks who have cancer, who are experiencing challenges with that treatment and chemotherapy. It's often used for issues regarding multiple sclerosis, HIV/AIDS, chronic pain, migraines, epilepsy, that sort of thing. There's some really promising research around all of these, disabilities that I just listed, and the way that THC, medical marijuana, medical cannabis, and CBD can really actually improve the quality of life of people that are experiencing these debilitating conditions. So it's promising research, but is there a lot of it yet? No, not really. And that's where some of the opinions and concerns come in regarding the use of medical cannabis, and why the use of cannabis medically or recreationally is not allowable federally yet. So it's important to consider both, the right to use as well as the risk to use when you're, looking at crossing state lines, when you're living in a Medicaid-funded, state or federally funded facility, if you have a child who's using it who needs a rescue dose, at school, right? There are still some really different interpretations of how, if, and when, and why products can be used in these different environments. That said, they're naturally occurring, and so that's something important to note, that many prescriptions that you're receiving from physicians are clearly not, naturally produced. They're highly produced, in fact, and considered black box meds for some folks, where other kids and adults have found that some of these more natural modalities and products actually really support whatever the condition is, as well as reduce some of the side effects that you might see with prescriptions. What I want to offer as well is that there's a new FDA-approved prescription called Epodilux. It's used for specific severe seizures. But it is one of those, it's a prescription that you would receive from your physician, you would pick up at a pharmacy. It would include dosing recommendations, as well as side effects, all of what you would expect from an antibiotic that you would pick up. But that's different than what you see in medical cannabis recommendations from physicians. They're not actually prescribing you medical cannabis, they're providing a recommendation that, like I said, you have to then process through the state. You bring that to a dispensary, and then it's really up to you and perhaps the prescribing or recommending physician to get a better idea of what's going to be the best route. A lot of folks interchange or use together CBD products as well as THC and find that tweaking the ratios of the two is actually what's most successful in addressing that condition. But so you have more questions. Of course you have more questions. It's a concept that really not a lot of people are talking about, at official formal meetings, but they're talking about, outside of those discussions. There is a local group here in Colorado called Realm of Caring. They're local to us in Colorado, but they offer support worldwide. So take a look at their website. They offer technical advice and guidance as a user or an interested party, and they also provide some really great resources for physicians who are interested in the product or interested in better understanding the studies and validation of the use of the product. They also have support groups and have built a really fabulous community around what does it mean to use cannabis products medicinally, and what does it mean to the individuals and the quality of life that they then receive from it. That's a really great resource. Also here locally, but it's a national group, is MAMAs, which stands for Mothers Advocating Medical Marijuana for Autism. It's a grassroots education group of mothers and interested parents. Here in Colorado, a group of these moms got together and helped pass some pretty important legislation for school delegation and school administration of medical cannabis or products, as well as autism becoming a qualifying condition for medical use as well. So those are just two examples of some great local resources. You'll also find NORML, NRML, that provides policy advice and helps to steer, kind of the use of medical marijuana and medical cannabis products throughout the state and federally. And of course, beyond advocacy resources, talk to your physician, right? It doesn't hurt to ask. Perhaps your physician is not one of those folks that's either on board or has really looked into some of the studies because it's not federally legal yet. But there are specific physicians here in Colorado and across the states that offer medical cannabis as legal products that offer really clear advice for you, your condition, what it means, how you might tweak some of those ratios that I mentioned before to really make sure that you are accessing the product and the treatment modality in the best possible way. Whether you're using it through patches, through nasal inhalants, lotions, edibles, there's a whole world of new options out there for you. And that medical physician is going to be able to best identify what the best route is for your condition or for the pain that you're experiencing. Holos Health is one locally that we know does some really great work, as well as Vibrant Health. These are groups that really have organized around medical cannabis use and provide a scientific approach to it. So whereas maybe in other states or when this was first legal in Colorado, there weren't really the resources available to physicians to provide the kind of advice that you will be looking for, especially as a person with a disability. You want to make sure that the new treatment modality that you'd like to or are interested in trying doesn't impact or impede prescriptions that you are taking that are necessary, right? That aren't going to be replaced by this new treatment. So you want to go into it cautiously, of course, like any medical treatment, like anything you want to get involved in or that may have some risks involved. So make sure you have a medical advisor that's helping you to explore that as a treatment option. So Petrie and Jeff are going to dive in with a series after this around medical cannabis use in schools, in adult services, and across the community settings. They'll help provide some more specific, practical advice. We'll put all of our resources and notes in our description of the video or podcast, wherever you're listening to us on. But thank you so much for tuning in. We look forward to offering you future Think Change trainings on contemporary subjects that impact you.
Think Change. Talks, trainings, and tools to help in your work for or with people with intellectual and other developmental disabilities. Learn more at www.thinkchange.training.